Hello, good day. My name is Kunal Contractor, and I'm the Global Director at Avaamo, looking after the Americas and Europe. Today, we'll be talking about digital transformation, automation, and conversational AI, especially in this, what some would say, unprecedented time with the coronavirus. I will minimize my mugshot to the corner so we can better see the screen. And people do say this is an unprecedented time, but the reality is, I think some of these elements are not necessarily unprecedented in the way that how much the world and business is changing. If you think about an unprecedented time when streaming started and, other players like Blockbuster just didn't catch up. When iPhones started making cameras that are better than, the big digital cameras, a lot of those companies didn't really catch up. So as the world is changing around us, and this has happened a number of times before, what can we do now to keep up and change and catch up to make sure we don't get left behind? So I'll talk to you today about the digital transformation, automation, and conversational AI from Avamo's perspective. And if you think about it, a couple of decades ago, if you didn't have a website, no one's going to do business with you. If you didn't have a good mobile device thereafter, no one's really going to do business with you. And in today's world, especially when you look at it from a post COVID perspective, if you don't have an AI first or a conversational first strategy moving forward, it's again going to be pretty difficult to get a lot of work done. So, things like personal assistants or digital assistants have been around for years. Sure, a lot of you already have Alexas or use a Google Home, talk to Siri on your iPhone. And the usage of that, and most of these statistics are again in our pre-COVID world, they're just exploding. More and more people are using digital assistants every single day. I mean, even if you think about those of you who have kids, the difference between a 17-year-old and a 12-year-old, a 17-year-old's all about text. It's impossible trying to get a word out of them. I mean, you've got to text them when dinner's ready. The 12-year-old, however, they are so used to using things like Siri, they barely text. They just talk to Siri and get her to do everything they need to do. So the world is rapidly changing with the use of these digital assistants, and it's still furthermore breaking into the professional world and the work world outside of just that consumer environment. So if you look at the multiple generations of conversation, the first generation are things like Siri. Hey, call Brian, or let's FaceTime Lisa, compose a text message, open Spotify. And the second generation is talking to things like Alexa, where she can actually perform even more transactions. If you say turn on welcome home, she can switch on the lights, turn up the heating, play some music. But if you wanted to say, Alexa, play Taylor Swift, set the volume to 7 and set shuffle, you have to say her name 3 times. You can't just say all of that and expect her to understand and remember it. And that's where we come into the third generation of conversational AI. And this is where humans can have a conversation with systems and multiple systems in the back end, with deep integrations where it can understand speech, not just in text, understand it in multiple languages, not just in English, and highly personalized. So it knows exactly who you are, what you've done before, and where you need to go. And the impact of these virtual assistants is pretty large. I mean, about a year ago, Gartner published these results that it can result in up to a 70% reduction in call volume, which is pretty important right now given so many industries. Phone lines are getting absolutely hammered, especially, think about airlines or hotels. An improvement in customer satisfaction. I mean, if your customers can get the information they need when they need it, why not automate that? Why have to have a human being fulfill that transaction? And from a business perspective, there's a massive reduction per interaction as well. So if we can improve customer satisfaction and save money at the same time, seems like a bit of a no-brainer. But it's not really that simple creating one of these. If you take an example in the insurance industry, does my policy lapse immediately if I miss a payment? But there's again many ways of making that statement. They can say, hey, I've just lost my job. I'm not going to be able to afford any more premiums. Will I still be able to have my insurance? So we can tell from that sentiment the guy's a little bit more worried. So understanding this, we've got to look through an immense number of workflows. Who is this person? How long have they been with us? What kind of a policy are they on? Do they have any payments outstanding? Do they have any procedures coming up in the future? And looking at that, a human could look into about 5 or 6 systems and come up with the answer in about 5 or 6 minutes, maybe less. An automated conversational AI system could figure that out in less than a second and come back to the user with that exact answer by looking into a range of structured and unstructured data from a number of systems. Another example would be, and we're doing this with a large carrier here in the US, hey, my phone's not working. Okay, well, there's going to be thousands of people who could say the exact same thing. So, what are we going to do about that? Well, the first person is an existing customer with a valid warranty. So, you know what? Let's troubleshoot. What's the issue? Second person is an unhappy customer. Maybe their warranty is also expiring soon. So, you know what? I've looked at that data. Why don't we exchange your phone for free and we'll give you a new phone? And the third person is with an expired warranty. So you know what? We'll sell you a new phone. So again, three people can say the exact same thing, but we know more information about them in our backend. So we can respond to them in three very different ways and take them down three very different paths. So looking at conversation as a service, we use a large range of advanced natural language processing, deep machine learning, and knowledge graphs. And this is the best way to really provide that experience for customers as you look at conversational AI. And these can be directed towards your customers, your employees, or even your suppliers and partners. It's not just for a single audience being customers. So if we look at the importance, let's say, of employee experience, which is really big right now, especially in recruitment, potentially for some organizations looking at remote workers, retention, and satisfaction. Forrester has said one of the major indicators of employee satisfaction is they've got the tools and the technology to get work done efficiently. Especially right now with all these Zoom meetings, Zoom bombings going on, people having pretty poor Wi-Fi connections at home, it's again becoming incredibly difficult to get that work done and efficiently, whilst also maybe having to look after your kids at home. So, everyone always seems to expect IT knows the answer and can fix everything right away. There's a lot of recurring issues, especially on the bandwidth for IT help desk, let alone your internet bandwidth at home, with limited resources and budget right now, and with more and more people using more apps and devices to connect. Conversational AI can massively automate a large number of those tickets, resolve them in one touch, reduce that average time to respond from a day to minutes, and especially password reset. We have a customer with about 15,000 employees. They do 7,000 password resets every single month. That would take them a 20-minute call to an offshore call center to get their password reset before. Now, through a conversational AI tool, they can have their own password reset by themselves at any time in less than a minute. So people are always looking for that self-service portal or a Google first option, but that's never always the best answer because that might not be the right answer for your organization. So again, a lot of benefits, and we'll share this deck later on so we don't have to have a death by PowerPoint in this environment. But a couple of other examples. So Ericsson used conversational AI through Avaamo for their internal service desk. As a large multinational oil and gas company, and it's really helping them in their innovation process. So really improving that speed to market for a new innovation pipeline they're working on. So they can automate the acceptance of new innovation pilots and making sure it goes through all the right compliance and regulations. Or Reliance, they're the largest company in India by market cap. It's deployed to about 50,000 employees, and in the first 6 months, they're able to reduce the trouble tickets handled by humans by around 40%. So a little bit about Avaamo. We're backed by Intel Capital. Pretty hard to get through the due diligence, but we use their chips to make our software and intelligence faster and better. And there's also a nice symbiotic relationship going back to them too. Our team come from TIBCO. So for those of you who are not familiar with TIBCO, they built a multi-billion-dollar business managing middleware, integrations, and social communication software. So this allows us and our team, and we're not a subsidiary or a spin-off, but it allows our team to really understand how to integrate into a lot of your back-end systems and make that work. And the rest of our team come from some of these other little-known startups in the Bay Area and abroad. Here's a selection of some of our customers. So, conversational AI isn't that new. It's been around for a while, and a lot of companies have already adopted it across a large variety of use cases. Some of the largest beer companies in the world, Volkswagen is one of the largest, of course, auto manufacturers in the world, helping logistics companies, railway companies, security companies, telecoms companies, and this is a range of both internal and external use cases. So it's not just for employees or just for customers. So again, a range of the use cases, and these are all live use cases that Avaamo have already implemented across a range of our customers. So, again, if you guys have any questions, happy to answer them towards the end, or please do feel free to email me later on. But really, there's three ways of automating conversations in the enterprise. The first one is talking to a knowledge base. Right now, even if you think about the COVID-related aspects, there are a ton of websites from the CDC, National Institutes of Health, the World Health Organization, in terms of information on COVID. Maybe internally you've got a massive employee handbook or a range of policies on the best way to implement a certain product. Or for customers, we've got, hundreds of websites they could visit on your own company's portal to find the information they need, but how are they going to find it? Maybe we can use a search. Well, search is based on inexact and error-ridden algorithms in many cases, even with Google, and I'll tell this example in a quick second. It doesn't have a lot of context, and it doesn't really learn as well as it goes along. Doesn't provide the exact answer you're looking for. So imagine if you search, and let's just say you've got 5 books on the table right in front of you. A search will then read through every single one of those 5 books at that time and say, hey, the answer you're looking for is in one of these 14 chapters. Now you go read it and figure it out. What a tool like Avaamo Answers can do is we can memorize all those 5 books and say the answer you're looking for is in page 58 in book 3, chapter 14. And here we've actually highlighted it for you. And I'll actually even show you an example of that in our COVID bot in just a few moments. The second kind of conversation we can automate is talking to an application. Think Service Desk, Salesforce, things like Epic or Cerner from a healthcare perspective, Oracle, your supply chain management capabilities. Just been working with some with the health organizations in the United Kingdom as we work through a number of supply chain capabilities, moving and figuring out where are all the ventilators and respirators, where are we going to need them in a few weeks' time, looking at our big data analytics, where are the cases popping up, and where are the cases being resolved, so we figure out where we can send the right PPE and the right number of ventilators to the right locations when we actually need them. But an example I'll show in a few moments with some of our healthcare clients is scheduling appointments. So instead of doing it through a human being, we can book an appointment, we can cancel, confirm an appointment, and it really does lead to a massive amount of increase in customer satisfaction and a huge savings in operational cost. Some of our healthcare customers, tens of millions of dollars on their call center, but nearly 30% of their calls were just to confirm an appointment, get directions, and get a fax number. And those are all things that can, swiftly be automated, no matter what your use cases could be. And the third one is talking to a contact center. So some of you may have experienced this. There's a large organization. They do TV and cable and internet. They may or may not own a large Hollywood studio. Let's keep them unnamed for now. But you can probably see where I'm going with this. You call in to their call center, takes you through an automated authentication process. Spend some time trying to figure out where in the tree you need to go to. Finally get through to an agent. They can't help you, so they have to transfer you to somebody else. The phone cuts out, so you've got to start all over again. So you've probably spent well over an hour on the phone, but maybe only 10 or 15 minutes of actual talk time trying to get done what you need to get done. What if you could make a phone call and only spend 10 minutes on the phone and actually get done what you needed to get done? I need to figure out, hey, are you guys offering any cancellations or waiving change fees? I need to update my payment details. I need to register my son on the new policy because he's just turned 18. We've bought him a car. I need to figure out, hey, is it safe to travel? What are my work from home policies? Can I expense a new router because internet at home is pretty slow and my current one just can't cope with it? And especially in a healthcare or a financial services capability, people aren't always comfortable discussing certain health ailments or fiscal situations with another human being because they, fear of getting judged. I'm pretty sure everybody listening to this today has Googled something they've never asked another human being before. So again, it's the same way. You're not asking another human being, you're relying on technology and automation to get you that answer that you need when you need it and immediately. So, a lot of conversational AI systems, they need to have a lot of integrations to the back end. So we have about 150 plus out of the box. So it's very easy to manage and get to the information you need to. Needs to be fully equipped with all the security credentials you can think of. On-prem, in the cloud, multi-factor authentication, voice biometric authentication, um, as well as adhering to, compliance aspects like HIPAA, PCI, PII, PHI, etc. So, no matter what tools you're looking at, make sure they do have those integrations, make sure they do tick all those boxes from a security perspective. But you know what? I am here talking about digital transformation, automation, and especially conversational AI. But the reality is that's not actually the answer. That's not what you're looking for. That's just a way to get you there. Are you looking to improve your customer experience or an employee experience? Improve your NPS, improve your employee satisfaction. I think it was Richard Branson who said, if you take care of your employees, they will take care of your business. But at the same time, how can we make sure we're reducing the cost to service our employees or our customers? Or how can we even drive revenue through automation? How can we automate sales or orders? How can, if somebody is looking to cancel an appointment, use behavioral science and nudge them to reschedule another appointment? So we're not actually missing out on that appointment. So again, those are the three products or three ways that conversational AI companies can automate the kind of conversations that are had in the enterprise today. But let me give you a quick example, a real life industry journey demo. So this is Livy. She's the bot from UC Health. She has an incredible personality. She has a passion for helping people. She's a married mother of two on a quest to complete all of Colorado's 14ers, so all the 14,000-foot mountains. She drives a Subaru and would rather drink a beer than having a glass of wine after a hike. So it's a pretty intense personality, and she's amazing. Extremely personalized. She can check you in for an appointment up to 24 hours before you have to go in. So again, both saving you and hospital staff time there in person. And again, at a time like this, you want to maintain your social distancing. You don't even really want to be around too many other people, even if it's from checking in for a medical appointment. So looking at that, entire patient journey, everything from searching. So I have Parkinson's. So we have not trained the bot specifically to say, hey, if somebody says they have Parkinson's, give them this specific answer. It's actually reading all the information or memorizing all the information on their website to tell them the most relevant answers. And there's also a difference in language when you're looking for a Burns clinic and looking for a Dr. Burns. So a lot of systems need to make sure that they can actually cope with that difference in natural language processing. And of course, that whole ironic situation, if you're actually looking for a Dr. Burns' Burns clinic, would be kind of ironic, but make sure they can understand that too. Looking for a physician by name or a specialty. So actually in the healthcare domain, if you said I'm looking for a heart doctor or a skin doctor, we understand that's not a medical term. You need to find a cardiologist or a dermatologist, and we can help guide you along that path. Getting a clinic locator. Hey, I've injured my knee and I need to find the closest ER. And you can share your location or type in where you are, and we can use GPS and the provider directory to get you to that right location. And then now we get into the fun stuff. This is actually integrated into Epic, the EHR. So you can schedule appointments. You can even cancel appointments, and like I mentioned earlier, using behavioral science to nudge them to reschedule a new appointment. Messaging your physician about any range of capabilities. So it's again in one nice, easy to use conversational environment as opposed to having to click through multiple screens. But something that's really relevant right now. Hey, I need to get a refill on a range of medications. Especially since I've been advised to, make sure I've got an extensive amount of meds available, but I've got zero refills left. So I need to message my PCP, get him to refill that prescription, and I need to change the pharmacy I pick it up from because I'm not getting it from the one across the road from work. I'm actually going to the one that's closest to my home now because, obviously I'm not going to work. Getting a reminder on your medications as well, immunizations, allergies, looking at your past test results. So maybe you had a blood panel done, maybe you're borderline, you've got high cholesterol. I need to understand what that means. What is HDL? Is a number good or bad? Is 41, decent? Is it in range? And maybe if you do have high cholesterol, we can also start advising you on the best kinds of exercises you may need to do. Because again, prevention is better than treatment. So, hey, maybe cut down on your red meat, reduce the amount of alcohol, which actually, given the environment we're in now, I think most places are seeing alcohol sales shoot through the roof as people are spending a lot of time at home. So maybe not so great for your cholesterol, but make sure you go out there and take a walk. So that's some stuff we were doing from a healthcare perspective with UC Health. With Volkswagen, they've deployed conversational AI to 940 dealerships across the US. So this allows them, and they've placed nearly actually 9,000 orders per month now, reduced the inquiry time from their orders from 3 hours to under 5 minutes. Organizations like Guam Telecom have implemented their employee self-service and looking at customer service next. And Birla Sun Life, one of the largest insurance companies in Asia, they've actually been able to increase new quotes by 41% in their first quarter, which actually led to $90 million more assured in those first 90 days. So pretty incredible. So I will now change from this presentation into what we've actually built for Project COVID. So this is a vaccine against misinformation. This is live right now. You can check it out at avaamo.ai/Project COVID. But this is also a bot that we are offering for free to any organization as is that can be placed on your website and that's fully trained from the CDC, the National Institute of Health, and the World Health Organization, plus Johns Hopkins and more. So you can click into it. And this can actually also be fully customized to your own brand and your organization with your own training data. So this splash screen, the logo, the name, the colors can all be customized to your brand. So first of all, let's click on Let's Get Started. I could come in and we use a lot of data analytics to look at, hey, what are people asking the most? The most common question, including from Google Trends, is how do I best protect myself? So coming into here, and it's pulling up all the right information. And again, directly from the CDC. So you could click into it, and as you can see, this actually opens up inline. So there's a whole range of information, and you don't lose the website page that you're on, and you're not getting redirected to another environment either. I can then come in and say, how many cases in the Bay Area? So in San Francisco, we're in the Bay Area. At the moment, it's only featuring cases by the state. But it actually understands that the Bay Area is a locality within the state of California. So it's clever enough to actually figure that out. But also, when you're looking at a large range of data, not only will it provide then the cases for California, but probably want to know what's going on in the rest of the country, as well as the next number of states that have the most number of cases and or potentially the deaths. So I can view more again from Johns Hopkins, from the CDC, and from the World Health Organization. We've also implemented a human loop system too. So you could say if that was good feedback or if it wasn't. Then again, people do ask questions such as, what are the common myths? So, in this case, I'm not looking for, a program in Greek myths. I'm actually looking at the myths for coronavirus. So again, it really understands that context. These are the common myths you might see regarding the coronavirus. So you could click onto that link, takes you through to the World Health Organization to see everything that might be considered as misinformation. So again, a large purpose of this bot is to be that vaccine against misinformation. Because yes, you could Google something, you could have a look around on the internet, but are those validated sources by the CDC or the World Health Organization? Is it something that your organization is providing to your customers or employees as validated with your own personal training data? So you could say, what are my company policies on COVID 19. So again, you can search through, and if you had your own specific policies, you would be able to implement that within this environment as well. Things like wearing a face mask, the regulations and the advice from the CDC had literally just changed over the weekend on Saturday. So at first, it recommended not to wear a face mask unless you're a medical professional, but now that's been updated, and this does get updated multiple times every single day. Understanding things like how does the coronavirus last, again, all the information you might need. So I want to be conscious of time. Thank you all very much for your time today. We're open for questions, and for anyone who's within organizations providing any form of support or help to anybody dealing with the coronavirus. Again, thank you all very much, and hope you stay safe, stay home, and remember to wash your hands. Thank you very much.